Hey, all you cool cats and kittens. Time for another one of Justin's presentations. I know you're all excited about this. You'll probably be sad too because this is the second to the last one that I'm aware of. I'll have you know that I was talking to Claudio and he did say that there's a possibility of us actually using Blackboard, that they have some sort of platform that we all can sit down and meet at the same time. You can see what I'm lecturing on and my face and ask questions virtually by raising your hand, like there's a raise your hand button and stuff of that nature. So I'll be looking at that over the next several weeks. I will look to implement that for the summer. Again, I like I said before, I'd like to do one-on-one, do a trauma, and then review one of these medical again, because I know medical is a lot to take in. So that's what I'll be looking to do, and hopefully I'll have a schedule made up for that soon once I figure that out. But let's go ahead and start. Chapter 23 is your toxicology. Let's start off with the definition of toxicology. They say it's a branch of science concerned with the nature, effects, and detections of poisons. It's also measurement and analysis of potential toxins, intoxication, banned substances, and RX meds, which is also with prescriptions presented in a person's body. So basically what they're saying is they're dealing with the poisonous effects of whatever it is that's been ingested or put into the body. We are dealing with being at a toxic level, and we'll get more into that as we go. There's some other things that you need to be able to recognize, and we will talk about carbon monoxide poison. Not really a whole lot of nerve agent gas poisoning. We're not going to get into that, but I will touch on a little bit. Also, how to contact poison control. That number's in there, and I'll talk about that more when we get there. Basically, what you're supposed to be able to do is be able to kind of figure out what drugs have kind of been taken based on signs and symptoms and presentation by the patient, including alcohol. Usually, typically, if you're going to do or have to deal with an alcohol, quote unquote, overdose, basically someone being severely intoxicated, usually it's going to be, for me, it's usually with Mr. Kazmar. It'll be with police or sheriff's office. It could also be in the home. You can go to a private residence and someone's been drinking and they're severely intoxicated. Oxycodone, which was really like narcotics, things of that nature. You got to recognize that along with heroin. They say illicit drugs is something you need to be worried about. Illicit by definition, by Webster, is forbidden by law, rules, or customs. When you are doing a history on these people, or you're going to ask them, because don't be afraid to ask them. You need to ask them, say, hey, listen, have you done, I usually use the word recreational. Have you done any recreational drugs? And reassure them, look, I'm not the police. And try not to ask them in front of the police. Or at least make sure that law enforcement, like if we're in the back of the ambulance, is standing with the door open to the side compartment door, where the patient can't see them if they're going to admit to them. You can say, hey, listen, have you done any recreational drugs? I need to know because I just need to be able to treat you. I don't care that you've done them. I'm not here to judge you. I just need to know what you've done just so I can be able to treat you. And you got to sell that with some sincerity too, because a lot of people, they're kind of hesitant to tell you, or they don't want to tell you because some of our uniforms we look like and dress like police officers. So they're a little hesitant to disclose that they have taken any recreational or illicit drugs. So try to get them to tell you if you can. Like, hey man, listen, I smell it on your breath, man. Seriously, like how many have you had? I mean, like, look, I'm not here to judge you or do anything. Or I need to know what to do. So that's how you get them to hopefully come clean with you. A poison is toxic by nature, of course, duh. What you're looking for, really, what you're trying to find the balance between what is therapeutic versus what is toxic. And that's like in medications, illicit drugs, or recreational drugs. Anything. I've got a slide in here too. You'll find I found it very amusing. I put it in here just because I wanted to show you that we're all addicts, believe it or not. But the overdose is the toxicologic emergency. That's when it becomes toxic and the patient is overdosed and there's too much in the body of a certain substance, and it's going to affect the body in a certain way. We'll talk more about that. That's called toxidromes. There are things that you can look for certain types of medications or signs and symptoms that lead back to a certain type of base medication. So we'll talk about that. So we also talk about toxicologic emergencies being intentional or unintentional. Intentional isn't always associated with suicide. I think I do have a slide in here, and I'm probably giving away or stealing my thunder for later, but there are people that take medication, and they go to several doctors. And remember when I told you that medication has 5 different names? The pharmacopoeia, or whatever, how you say it, the pharmacopoeia, or whatever it is. It's got 5 different names, and we usually go by either the generic name or the trade name, is what we call medication. So they may go see a doctor and they have high blood pressure, or their blood pressure is a little bit high, and their specialty doctor says, "Oh, I noticed your blood pressure's high. Let me put you on some blood pressure medicine." Well, then they've got 2 types of blood pressure medicines, and they're actually the same one, and they're just double up. They have 2 different names, and I'll explain that here in a little bit. So it could be that they're actually they're intentionally taking 2 medicines for blood pressure, but it's the same medicine, and it's wind up being too much. That I've seen that happen. That could be unintentionally intentional. So we don't want to just assume that overdoses are just suicide, because there's also other reasons and factors for that too. We'll get into that. So we've got to, find out if it is intentional, unintentional, and if there was a means for the person to do it to hurt themselves. That's when it goes back to kind of a psych call too, because now they're having suicidal ideations, and then, they're going to need help and stuff like that. So you've got to pay attention to that kind of stuff. So I find this very amusing. Types of toxicological emergencies can be found in nature or the workplace. I think what they're really meaning is the things that can be toxic. You can find them out in the woods, and they could be plant-based and stuff like that. But really also in the workplace, there's, you got to think chemicals. There's a lot of chemicals in the workplace. Even if you, even in your home, you have household cleaners. Those can be caustic or acidic or alkalinic. So there's the potential for some sort of accidental ingestion or something of that matter. Again, we go back to it could be an overdose or too much of anything from neglect or oversight. Like I just told you, some people may have 2 types of medication, same medications, just different names, and they don't recognize the 2 different names or the same medication, and they're taking too much. So we're not really going to talk about chemical, biological warfare, but it's there. But that's kind of happened when we were talking back when the EMS safety portion for biological warfares or weapons of mass destruction and stuff like that. But we will touch on the date rape drug. I'll tell you what it is. There's not really much you can do for it as far as the effects of it. This is right here, what you need. That's poison control. Feel free to put that in your phone. It doesn't matter if you work in EMS or not. If you have children or you have somebody that is not in a full mental capacity that may potentially eat or drink something that may be harmful for them, you call this number here. Now, I'm going to warn you, this number, when you dial it, believe it or not, is state specific. And what I mean by that is I have a North Carolina area code and prefix. So when I dial this number, even though I'm in Georgia, I get rocked over and connected to the North Carolina poison control. Truth be said, it really doesn't matter. I don't really tell them where I'm from. I'm like, hey, I'm an EMS provider, and I need to know side effects for this, and this. Because let me tell you, you're going to come in contact with medications that you have no idea. You're only going to expose to 12 or 15, maybe possibly 20 meds that you're going to really have to kind of know. And those are pretty much the ones that you're going to be able to give, and kind of the certain classes of medications. I'll explain that when we get into pharmacology and we get the advanced portion. But you're not going to know every medicine. And if somebody decided to OD on something intentionally to hurt themselves, they don't know what they're taking. So they may just took a bottle of pill that was full and just like slammed them all and then chased it with beer or alcohol or something like that in an effort to hurt themselves, and they wind up not really hurting themselves. I mean, I've seen people take ibuprofen because they didn't realize it was Motrin. They just saw that there was a prescription, like 800 milligram pill ibuprofen or in there, and they didn't know what it was. And so what they did is they took a whole bunch of that, and it's pretty much like, you'll be okay. So because people don't know, they're just going to take it. So people don't know, you won't know. So put that number in your phone or memorize it. We're going to talk about the routes of absorption. I love these slideshows. Toxins cannot exert their effects until they enter the human body. That's kind of like, duh. But maybe one of you guys needed to hear that. I don't know. These are the 4 routes. We're going to talk about them. So don't freak out yet. The effects and excretion rate depends on the amount of toxin and the speed of metabolizing. Also, it has to do with how much, the amount those put in, how quickly we can break it down, metabolize it, and excrete it. But also the route in which it was brought in. The route in which it was brought in also will affect how bad it is and how detrimental or how quickly it'll affect us, because not all of the main ways to get into the body are the same. We're going to talk about the time as well. Most common one, obviously, is ingestion. People are going to take medicines. And it's easy. Like I said, you have a whole pharmacy pretty much, if you especially live with someone that's older, and their medicine cabinet. Like even I, over the course of the years, have a plastic box. I have a tub that I just keep all of my medicines in. And I've got Flexeril. I've never taken it, but it's a muscle relaxer. I've taken it and I've kept it just in the event that if I do hurt myself, because I am getting older and I could probably hurt myself in the line of work that I do, especially on the fire side, or even in EMS, just lifting. I might pull my back. I pulled my back probably about 2 months ago. I don't think you guys noticed it. We were still in class, but I pulled it bad. It was out for about 5 days, and I just pulled a muscle in my back and it hurt. I had to wrap it, take a bunch of ibuprofen. I ate it like candy until it started feeling better, and then I was good to go. Use one of those back braces, but still, you can have medications, household chemicals. That's another thing, man. You can go to the store and buy bleach and radiator fluid. People do that, and I'll explain why they do that. But there you go. So it's around the house. So it's a very common source of ingestion. The good news is with ingestion, you actually have time to hopefully kind of fix that. Now, do not, please, for the love of God, do not get your patient to vomit. Not saying that they won't vomit on their own, but do not try to force your patient to vomit. They may have ingested something very caustic, very alkalitic or acidotic, and going down the esophagus once was bad. Now it's mixed with some more acid in your stomach. Remember, the stomach doesn't do any absorption. It's just there to break it down and start digestion and start breaking it down and getting ready for absorption in the small intestines. So with that being said, if they throw it back up, now it's acidic again. And you have all the chemical coming up, now even more acid. So it's going to damage the esophagus twice, along with the oral cavity. So, but you have a forgiving time frame. Remember, it's about 30 minutes for everything to get digested. So you've got this 30-minute window to try to do something. Also, because again, you've got 30 minutes where the stomach's breaking it down. The stomach's not ingesting not absorbing any nutrients or any of that. It's just there to do it. Now, some's going to get through. It's going to start taking effect, but you have a window of time. Because remember, also, you've got first pass metabolism. So this is true for medication, but it's also true for any toxicological emergency, any poisoning. So the liver could possibly take and break some of that down so it's not so dangerous. Now, with that being said, it can affect the liver. Remember, you've got portal circulation, so if it goes into the small intestines, it starts getting absorbed out, and it's going to go straight to the liver. The liver can probably break some of that down and stop it from being too toxic, but the problem is the damage that the liver is going to receive. The liver is going to take the first hit. So it's going to take the first hit and start actually having some damage done to it. So there's a possibility of that. Tylenol is a big one. So you've got to be concerned with that. How you correct it. I'm not going to introduce you to dosaging. I'm not going to introduce you to anything else, but I'm just going to introduce you to the medication. This is called Actidose. It's another word for activated charcoal. And what it does is that you have 30 minutes or less from the ingestion. And if I remember correctly, this stuff does not taste great. This is nasty. It's literally got charcoal in it. And so what happens though is that if it's still in the stomach and you're in that 30-minute window, you shake this up. Some of them even come with like cherry flavoring, which is really nice. You can squirt the little cherry flavoring in there. It even comes with a straw. I did have, excuse me, Corona. I did have somebody. She was working as a housekeeper, and apparently instead of telling her boss she was high and had meth on her, she decided that she would do the meth, go to work. As soon as she got there, got paranoid, and then decided to eat like a gram of meth. And then called us. And like the boss, like, I have no idea what's going on. Why did she call you? And then she said, yeah, I swallowed a gram of meth. So we were in the 30-minute window. So like a champ, man, she swallowed this. Now, normally when people swallow this and they wind up drinking, and they have to drink this whole bottle, when they wind up doing that, they usually puke. So get ready for that. So if you're breaking out this Actidose or activated charcoal, you need to give them a puke bag because this is coming back up more than likely. But if they are able to go ahead and swallow this, that's great. So how it works is it actually comes and it'll take the poisonous, like the medications or whatever, and it will basically form a protective covering around it. The charcoal doesn't allow the small intestines to absorb any of that. So what you've got is you've got all that poison in there, but it's bound and held together, and it'll solidify in and around that as it's going through. It'll keep it and bind to it and hold it so it will not absorb and let the small intestines absorb any of it. Now, some of it might get through because you are it's still a slurry, but it's hopefully going to protect the medicine now, or the poison, excuse me. Now, with that being said, if patients take medications as well, or they overdosed on medications and they're still able to do this, it's going to make all the medications they just took null and void. So they're going to have to probably at some point retake their medications or worry about it the next day and then go from there. So remember, 30-minute window, they've got to take the whole thing, and they must be alert and they must be able to swallow. Do not try to shove this down somebody's throat that's half awake, half semi-conscious. More than likely, if they're semi-conscious, this is not going to work anyways because it's already being absorbed. So keep that in mind. Contraindications for activated charcoal. If they've been ingested acids or alkalis or petroleum products, like gas or diesel fuel, something of that nature. And I have seen people do it. I've seen people drink gas in order to try to kill themselves. I don't know why, but that's it. Altered level of consciousness and cannot protect their airway, which also means more than likely they won't be able to swallow. They've got to be able to be alert and be able to swallow. The side effects of the activated charcoal, or also known as Actidose, again, I told you, vomiting. It's probably coming back up. The girl that wound up swallowing the meth took it like a champ. Usually, for some reason, I have found that usually if they're addicted to methamphetamines, they're champs. They will take this and they will not puke it up. Now, I've seen other people that any other poison that have taken this, and I've only used this about 4 or 5 times in my career, they will puke this up, and it's coming back out in the same way it went back in. It looks horrible and nasty. But if they do keep it down, they'll have just black stools. And the reason why that's important is because it can mimic or look like, it won't smell like, but it will look like a GI bleed. So be careful of that. Obviously, the nausea is induced to the vomiting, and if they do throw up, you need to be worried about airway problems. You need to be looking to suction that airway. So be very aware. Inhalation, basically inhaling. They're going to try to breathe in whatever the toxic poison or the substance is. Typically, it's going to be household chemicals. Some medications, I really don't know how they would do that. Crush it up maybe and try to put it in water and breathe it in. I don't know. But with that being said, depending on what they're doing, it could be a toxic, hazardous environment. I'll talk about that here in a minute. So the idea is basically to get it, if you can get it in, you can get it across the alveoli and get into the bloodstream very quickly. If it's a big enough dosing or problem, you need to be very, very aware of your scene safety. If you're walking into a home and you've got 3 or 4 people, altered level of consciousness, be thinking this could be an inhalation. Now, granted, they could have been sharing the same drugs and they all overdosed at the same time. Very possible. But also, this could be an inhalation. It could be in the air. So be very wary that you do not become a victim, and then now you're part of the scene that people outside, hopefully, will have to be able to get you out. I work in rural EMS as well. Up here where I live, we only have 2 ambulances, and we have a volunteer fire department. So sometimes the volunteers don't come on med calls. It's just they don't like running med calls. I don't blame them. Now, some of them like us and respect us a lot and will come out and help us lift, carry, do whatever. But at the same token, if they don't want to come, they don't have to. One of the things too, and this should have been back in ingestion, because if you find any of the empty bottles, containers, or labels, or like a paint can or anything, any household cleaner that you think they may have ingested or tried to inhale, take it with you, because again, the doc's going to need that. Also, you can call poison control and say, listen, I think my patient has inhaled this or ingested this. So, also another thing though, not only so for the alveoli, but it's also an oxygen displacer. So if you're trying to inhale fumes, you're not breathing oxygen, so you're basically going to displace the oxygen. Therefore, you're not getting the oxygen you need, and it'll leave you hypoxic. So you may have to try to address that. Part of the problem is some of it may actually cover the alveoli and not allow anything to do gas exchange. So they may have screwed themselves severely. So again, that's what you're looking for and looking to treat. Something that was big when I was a kid, I don't know if it's still around, but I put it in here. It may have another name, but it was huffing. Basically, people would put like spray paint into a paper bag, and then they would put it up to their face and then breathe in the paint fumes. I have no idea. Apparently, it creates a euphoria or a high. Another one was the Cool Whip cans or the Ready Whip or whatever it is. It comes in the spray bottle. They would hold it at a certain angle, and it would just off-gas whatever the gas that was in there that was basically pressurizing it to push out the whipped cream. And they could hold it at a certain angle, and they'd catch the gas coming out, and it would get them high. Another one that the guys used to like to do is they would punch each other and square in the back. And somehow they would wind up actually kind of like knocking the wind out of each other, and they would displace the oxygen, and then they would get high because therefore they're not getting enough oxygen. They become lightheaded, stuff like that. One of the things that you do want to look for is paint or stains around the faces or clothes. I think I put a picture in here. I did. Like something like this. They're like I said, they'll put it into a bag of some sort and they'll try to breathe it off. And that if it's like paint or any kind of cleaner or anything like that, you'll see it around their face. That dude's smiling probably because he's stoned as shit. Another thing is they'll put it in some sort of like milk jug or milk carton, and they'll try to breathe it off from there if it doesn't come into a plastic container already. This dude apparently decided to just take whatever the hell it was and just put it in, and he passed straight out, and he's probably on his way out the door. So those are the things that can clue you in as basically that there's something going on. It might be really weird. You find a patient with like a can of spray paint in the bed. Well, you never know. Some of the homes you walk into are not the cleanest of homes. And they have just crap everywhere. And I've seen paint cans and stuff in bedrooms before and never thought anything of it. Like we weren't there for that reason. But like, I mean, people just are lazy and don't pick up their stuff. And if you're that way, I apologize. I don't mean to offend you, but at the same time, like for me, there's a place for everything. Everything has its place. So that's the kind of person I am. But again, so just be very wary. If you got an altered mental status or altered level of consciousness, there's a couple pans of spray paint and they're empty. May want to look into that. Here's more household goods. I'll let you look at that because you've got the slide. I'll put the PowerPoint up, obviously, with this as well. Injection. This is the fastest way to get anything into your system. You are bypassing any absorption. When we talk about skin, absorption is pretty slow. IM obviously is a little bit faster. It is pretty quick. Just like sub-Q is a little bit quicker, but absorption through the skin is not very fast. It takes a little bit. Obviously, swallowing or ingesting is the slowest. So, for a quiz, ingestion is the slowest, and injection is the fastest? We'll see who pays attention, because I'll probably do a blank question and you'll be looking for the answers. But injection is by far the fastest. Puts it in the bloodstream, bypasses the liver, and it starts taking effect on target cells and organs immediately. We talked about accidental overdoses. So, case in point, even if it is illicit or AKA recreational drugs, what can happen is that people go to rehab or they go to jail and they don't have access to these medications, these illicit drugs anymore. So you may have like a heroin addict or a meth addict that is using for years or for months on end, and they wind up getting popped. They go to jail. Thank you, Kazmar, for what you do. Thank you for your service, Kazmar. I love you. But with that being said, they go to jail. Obviously, they may be able to get drugs in jail. I don't know. But more than likely, the idea is they don't get it. So when they come back out, they're looking to get high. They want to get stoned again. Yeah, I did my time, did my rehab, whatever. Screw that. I'm ready to get high again. So what happens is their body got used to, over time, needing more and more and more to achieve the same high. They built up a tolerance. Now they no longer have that tolerance. Their body is adjusted back to not having that illicit drug in their system anymore. So what they do is they go out and they're like, hey man, I used to take, this much, a whole big much of this drug. And what they do is they'll take the big fat huge dose and they'll wind up overdosing and dying, or they'll overdose severely to the point where you've got to intervene because they are used to taking that dose. They're like, hey, give me my normal dose. And now they're looking to get high. But it's worse because they built up the tolerance initially to do that dose, but that tolerance is now gone. So now they're doing this big dose, and that's where you have to come in. So it could be an intentional accidental overdose. Absorption. Typically, they're saying it's usually poisons or pesticides or chemicals that wind up on the skin and get absorbed in. You can also, it's not just the skin. You can have them come through the mucous membranes, which is your nasal cavity, your oral cavity, your eyes. It can get in through your eyes. That has happened. That's why you'll see where they have like those eye wash stations where you're supposed to rinse your eyes for 30 minutes and stuff like that. So, that's what you're looking for. Contact burns is when it's basically contacts skin and it's burning it actively and you've got to remove it. Or versus absorption, because sometimes it just may contact the skin and cause a burn. Other times it might actually contact the skin and be absorbed, and it can burn as well. So it all depends. By absorption, you basically need to remove the substance. Now, the bad part is some substances, they say you're supposed to irrigate with water or whatever. Some substances, you cannot do that. If it's on the skin, you may want to try first brushing it away. The problem is that you've got to make sure it doesn't get on you. Remember your scene safety. So if you walk in and somebody, say, got pesticides and they're spreading out pesticides using their hands, and they got it in their hands and it absorbed through, and they've been doing it kind of all day, because I've had that call, not once, but twice, by the same person, and I was working a 48, and it was 2 days in a row. She obviously didn't learn the first day. She was putting out pesticide using her hands. She wasn't using gloves, and she was using her hands, and she would get it all over her hands, and then she didn't understand what happened the first time, apparently. Even though we told her, like, look, you were touching this pesticide. I'm pretty sure that's what caused it. And we took her to the hospital. They treated her, released her, and she did it again the next day. And I happened to run her both days. And the second day, I was like, look, lady, you can't do this. You got to at least wear gloves, something. So you need to brush it away. So when you come into these scenes, you need to kind of be very wary of your surrounding, what's going on. So altered mental status is a huge, broad category. Anything can really cause altered mental status or altered level of consciousness. So be very careful. So one of the things that you can happen is have this poisoning on their hands, on their body somewhere, and need to brush it away, and then you can irrigate with water. And believe it or not, we do have sterile water on the truck. We're supposed to have, I think, by law in Georgia, at least, I want to say 500 to 1,000 milliliters of sterile water, which is not a lot, by the way. It's enough to get like a little bit off and then to make sure it irrigates out, but it's not a lot. So if it gets in their eyes, you can do there's some tricks that I'm going to teach you to be able to get it in their eye if it gets in their eyes. That'll be the next slide. Cross contamination. So if you get it on you, You need to remove your clothes and before you step in the back of the ambulance. Before you put them in the back of the ambulance, cut the clothes off. If it's on their clothes and it's all over them, you need to make it so it's not on them anymore. And I realize that making someone naked in the middle of the road, like when we start doing shock trauma, when we expose, it's not ideal. I understand you want to protect a person's privacy. I get it. So I'm a big proponent of putting them on a backboard, putting them in the back of the ambulance, and then cut the clothes off and expose them there, maintaining some decency, unless it's really bad. I've done it on the middle of the road too. But also for these patients that are exposed and have these substances all over the body, you need to go ahead and cut their clothes off. Keep that all isolated to one spot. And also brush it off and irrigate it. If you have to, irrigate it off after that. What they were showing in the last slide here is I'm giving you a better picture of. So in the event you don't have an eye wash station, because, most ambulances don't have one, you can actually take a nasal cannula, and we will do this in class when we get back in lab. Someone please remind me if I forget. But you can rig this up to where you can take a nasal cannula, cut it, put in a drop set from a saline bag, and set this up so it literally takes and drains and irrigates their eyes. I've done it several times. Neat trick. Excuse me, Rona. And it works, and it helps irrigate their eyes and get some of that chemical out of their eyes. Transdermal patches. You want to look for these because if you have an altered mental status and it looks like it might be a narcotic overdose, you want to start looking for fentanyl patches. Also look for fentanyl patches in the mouth, under the tongue. The tongue is the mouth is very vascular, especially under the tongue. That's why you can do sublingual medications. Nitroglycerin, one of the medications for chest pain that you're going to learn, you can do under the tongue because it's very vascular and it will take and absorb the medicine and carry it out that way. People like to get high, and what they'll do is they'll take the fentanyl patch and they'll stick it up underneath their tongue and get high that way. FYI. But if you find fentanyl patches, even nitro patches, nitroglycerin, you can use as a paste. They'll put it on and they'll cover it with like a plastic dressing, occlusive dressing over it. You may have to take that off and then take a rag and wipe it. So you may have to do the same thing here, is just peel them and then wipe them off. All right, so now that we kind of talk about how the poisons can get into the body, now you need to know the word called toxidromes. Toxidromes are basically set signs and symptoms from certain types of medications that fall into classes. Let me say that again. Toxidromes are certain signs and symptoms that basically you'll get from the same type of medications or same type of poisoning. They're similar signs and symptoms, and that's how they get grouped into classes. We're going to talk about toxidromes. It's also, some of them are just medication classes. Like narcotics. Narcotics is a toxidrome. It falls under the central nervous system depressant, and it's a toxidrome. So here we go. Just understand that a toxidrome is just basically a group of similar signs and symptoms of a certain type of toxic ingestion or poisoning that exhibits the same similar signs and symptoms. It's basically, that's what makes them toxidromes. Big fancy word for basically says, oh, this group of drugs does this. Lowers their heart rate, lowers their respiratory rate, lowers their blood pressure, makes their pupils constricted, and that's basically narcotics. So it has a similar set of signs and symptoms. Makes it a toxidrome. Hint, hint, nudge, nudge, wink, wink. So we're going to talk about some major ones. The first one they want to talk about is cholinergics. Okay? These are going to be big words. You're just going to have to learn these. I'm sorry we're not in class, but it's cholinergics. So it stops acetylcholine, which is a neurotransmitter. It mimics the action of it. So cholinergics mimic acetylcholine in the parasympathetic nervous system. Let's do a little review. Okay. Remember, central nervous system. Start with a big review. Central nervous system is our brain and spinal cord. Ta-da! The peripheral is all the nerve paths that come off the spinal cord. So, with that being said, you've got your motor and your sensory. All right? So, under your motor, you've got the somatic, which basically means that's the stuff you control. In your motor, you got motor, sensory you feel, motor you move. You got the one. Somatic basically means muscle movement you control. I'm moving my hand. That's somatic nervous system. Autonomic. Auto means it does by itself. Remember when I told you how much of a pain in the ass it would be to sit there and think all the time, breathe, breathe, heartbeat, 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 breathe, heartbeat, 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 breathe, heartbeat, 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 breathe. So your brain has developed, especially in the brainstem, to go ahead and do it for you. Under that, you've got means of ways to control it. If you get scared, you've got your fight or flight. That's your sympathetic. It revs it up. Your eyes dilate, get bigger to take in more light so you can be able to see better. Heart rate goes up, blood pressure goes up. You start breathing faster, start taking in more air because you're either going to stay and fight or you're going to run like hell. And either way, you're going to need more oxygen. You're going to need adrenaline pumping. You need your heart rate up. You've got to go, 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 go. So under that, though, we can slow it down. Rest and digest, also known as feed and breed. Just basically slow it down. Like, whoa, we don't need to be beating so fast. We're just sitting here. Nothing's scaring us. And we don't have to fight or flight. Let's just chill and relax. The cholinergic affects here. And what it does is it takes the parasympathetic reaction or the parasympathetic division and it mimics it. So there you are, resting and digesting. And then you take some sort of cholinergic and now you're resting and digesting even worse. Resting and digesting is good, but you can overkill rest and digest. So how does it work? Remember, in our neurology, we have the axon coming from the body of a neuron. This is all the way down to the nerve cell. And remember, we have the vesicles that would secrete over to cross the synaptic cleft to the dendrite that would receive the message. Well, what it does is it says, hey, it's going to release the acetylcholine. All right, so now we're going to release more. So there you have it. So just remember, cholinergics basically mimic the parasympathetic nervous system. You're going to have to take notes, ladies and gentlemen. I hate it for you, but that's just how it works. How this usually and typically works is organophosphate. Organophosphate. That's usually found in your pesticides. So remember I was telling you about the pesticides, the lady that we have for the pesticides? Well, there she was, slow and sluggish and, oh my God, dizzy. I have a hard time breathing. Because when you rest and digest, you slow your respiratory rate, you slow your heart rate down, you're slowing all that. Now you've just added on top of that to do even more. So now you're really bradycardic, bradyapnea. Now you're just confused because you're trying to perfuse. You're hypotensive. And you're trying to maintain a mental status. Remember, your brain needs a certain blood pressure, certain systolic blood pressure to maintain and function. If you drop it below 90 systolic, which is 90 is your top number, you drop below 90, your brain says, what the hell, bro? What happened? So you're vasodilating and you just can't keep your pressure up. They use the mnemonics. We're going to talk about those. Sludge and dumbbells. It's kind of just same. You can pick one or the other. Sludge is salivate. You will salivate when you rest and digest. When you're eating, you salivate. When you're eating, you're resting. Lacrimation, urination. You pee. You will poop yourself. I've seen people poop themselves. Gastric cramping. You'll throw up because you got that poison in there. Kind of the same thing. Diarrhea, urination, meiosis, which means basically your eyes will constrict. Bronchospasms, they call it bronchorrhea, but it's bronchospasms. Body fasciculations, which basically means tremor, shaking. Emesis, which means you vomit. You have lethargy, and you'll salivate. So you have all these issues with cholinergic. Again, more than likely it's organophosphate poisoning, which is usually found in your pesticides. And there we go. Like I said, they'll use it in nerve gas. You probably won't see that, hopefully. If we see nerve gas, chemical warfare, shit has hit the fan. I don't know how else to say that, but it's going to be bad. But it's mainly in your insecticides. And usually it's people working in their gardens. That's usually where you'll find these people. Like I said, I had that one woman throwing pesticides out every day with her hands, and that she had organophosphate poisoning. Treatment, high flow to vascular access, transport immediately. Probably going to need to maybe give them a little fluid challenge when you get to your advance. You can start giving fluids. You'll need paramedic intercept. The medication to treat this is high doses of atropine. So, but you don't need to know the atropine. I'm just letting you know that it's there. All right, so now we got another one called anticholinergics. Anti just means against it. It means it does the opposite. All this does is it blocks the rest and digest. So what happens is you're trying to rest and digest. You've taken anticholinergic, you've been exposed to it, and now you're trying to rest and digest, and you can't. And what they do for that is they give you this. Mad as a hatter, blind as a bat, red as a beet, hot as a hair, dry as a bone. What that basically means, and it'll explain it over here just as well. Mad as a hatter. You'll have altered mental status. You'll be confused. Remember, you can't rest and digest. So blind as a bat. You'll dilate your pupils. Well, if you dilate them all the way out, you're taking in a lot of light. The light literally will blind you. Red as a beet. Flushed skin. You're no longer able to just have the nice, cool, warm, pink, and dry skin. You have red, flushed skin. Hot as a hair. Your metabolism is getting revved, so you're hot. Dry as a bone. Your mucous membranes. You're not salivating anymore. You don't have that anymore. So there you have it. So I'm trying to think. Anticholinergics, I really can't think of any, but you're going to have to just kind of remember the cholinergic and the anticholinergic. You're going to have to study on this one. I know this is a lot of new material, and I really wish I could do this in person, but you're going to have to study these. Another one is called a sympathomimetic. All right, remember, we're still on the autonomic nervous system. This one, mimetics, mimic, mimetics, mimic, mimetics, mimic, mimic. You're going to mimic the sympathetic nervous system. So what happens is it's kind of like the anticholinergic, but it's way worse. It's worse. Like, yeah, you'll have all the same things that you get from that, but it's going to be way worse. This is also going to include like hypertension, tachycardia, tachypnea, and the one sympathetic mimetic that you're going to be able to give for you, it'll be anaphylactic shock. Basically, when you deal with an allergic reaction that's very severe, epi. And basically, sympathomimetics rev up the nervous system. So one of the things that I tell people is when they do have an anaphylactic reaction, I try to stick with the Benadryl. Well, the Benadryl makes most people sleepy. For me, it'll knock me into the ground. Like I'm out for I take 50 milligrams of Benadryl, I'm out for 2 to 3 hours. Easy. Like it'll literally hit me about, obviously first pass metabolism, about 15, 30 minutes, I'm passed out. So with that being said, on the opposite of that, you guys will be able to give the epi. The epi is going to rev these people up. So they're going to feel like their heart's racing. They're breathing fast. They can't catch their breath. God, my head is pounding because their blood pressure is up. So that's the sympathomimetic. It mimics the sympathetic nervous system. That's how you remember that. Stimulants. Stimulants kind of fall into the same thing. Sympathomimetics. The big major toxidromes or the illicit drugs, aka recreational drugs, is going to be cocaine and amphetamines. You can smoke them, you can inject them, apparently you can swallow them. I've never seen anybody swallow cocaine or meth. Usually it's smoked or injected. Again, excuse me, Rona. They'll be very excited, revved up. Their metabolism's going. They'll be like, be talking out of their head. They'll be hypertensive, but if they are tachycardic, their blood won't be refilling in the chambers because it's just beating so fast that it doesn't give it time to fill back up with blood because remember we talked about cardiology, do the atrial kick, throw blood into the ventricles, and then you'll squeeze the ventricles and out eject the blood. Well, if you're going too fast, it doesn't have time to fill up. It's not filling up with blood. So therefore, you may have hypotension because they're not ejecting any blood into the vascular system, like out in the aorta. And there you go, you have it. They can also have heart attacks because of this, because they're just not getting enough oxygen to the myocardium, which is going 160, 180 beats per minute. And it's not giving time. Remember, the heart muscle gets their blood on diastole. It's the only muscle tissue that gets on diastole. Everything else, the blood is pushed forward and with a systolic pressure and movement from the left ventricle. Well, it's not giving enough time to rest. So people will actually truly have heart attacks. You will see them having heart attacks. They will not get enough oxygen to their myocardium and their heart muscle, and they will have heart attacks. That's how that happens. Dilated pupils, they're blown wide open because that's what you do. It's your fight or flight. Cocaine, you snort it. I don't know much about cocaine. I'll be honest with you. The most I've ever been is buzzed. I've never even smoked marijuana. I have been around people that have and got a contact high. The only thing that happens is it makes this fat boy hungry. That's all it does. But for cocaine, it is a stimulant. Amphetamines, same thing. The thing about cocaine, it's very expensive. Methamphetamines are not. They are basically the poor people's drugs. So one of the things you need to be careful of is if you are going into an ultra-metal status, it could be that they have done methamphetamines. Again, ultra-metal status, ultra-level consciousness could be 100 things, but you got to be careful you don't walk into a meth lab. This is new on me. I actually had to look this up because I saw it in your book and I was like, what is this? It's called cathinones. Apparently it's a problem, and I actually knew a girl, and this was like 20 years ago when I dated her. She was addicted to the decongestions. I guess which is where you get the derivative or part of the derivative for your methamphetamine. So I think it might be that, but apparently it's a catha shrub. Same thing. It's a stimulant. I know nothing about it. Maybe if we were in class, Kazmar could help me, or somebody could fill me in. I really don't know, but it's there. And here's the slide I decided to throw in because I've done three of these 4 things today. Obviously, everyone knows about my snooze. And I have one in actually right now as we're talking. I put Mountain Dew up because it's got the most caffeine, but Coke, Diet Coke even has caffeine. Coffee has caffeine. Some people smoke. I don't think any of you said you do smoke. I like cigars, so that's going to also happen tonight. I've got some cigars that a friend sent me, and I'll be having one tonight, I'm sure. So there, I hit all 4. The question is, how many of you hit today? So don't judge, but caffeine and nicotine are stimulants. Caffeine, obviously, is a stimulant and stays a stimulant. Nicotine actually starts off as a stimulant and then kind of brings you back down and kind of makes you real peaceful and relaxed. So there you go. We talked about some of the side effects of cocaine. Myocardial infarction, that does happen again because our heart rate's so fast. The myocardium is not getting any adequate perfusion. They can't have seizures because it's just too fast. The brain is not getting enough oxygen either. They can stroke out. They can rupture. If they're hypertensive, they can rupture a blood vessel. Apnea, I've never really seen that, but hypothermia, yes, absolutely. They're hot. And it's same with that and methamphetamines. If you got somebody that's taken a lot of methamphetamines, there is a possibility that their core body temperature will be about 102 to 103, which is very dangerous. I've had somebody that I've had to actually use ketamine on, which will paralyze them, but let them still breathe, and just to transport them because they were just running around wild, naked in the middle of the road. So that was fun. Treatments for these is do your O2 sats. You can't really do anything for this. You're just gonna have to really manage, give them oxygen, try to do vital signs. Try to figure out how you can slow that. You're not really be able to slow the heart rate down because it's the stimulant. It's not an actual cause or causation from the body itself. It's from the toxic ingestion or injection they've taken. So you probably need ALS backup because more than likely you may have to sedate these people. Usually what happens is in the hospital, they'll go in and they'll knock these people down and put them on vents and try to get their core body temperature down and try to let the drug run its course and just do just standard care. Just basically just kind of manage them until they've metabolized all this out. And the bad thing is they'll do all this work. More than likely these people don't have insurance, and then they get them back to where they're back on the good of normal, and they basically release them and then they go do it again. And it's very sad. So it happens. Another major toxidrome is narcotics. Narcotics are pretty much used to relieve pain. But with the side effect of that is they do cause drowsiness. Stupor basically means like a kind of a suppressed level of consciousness. They're just kind of slow, sluggish, whatever. It affects their mood and behavior, especially if they start using it for non-medical purposes. People, I don't know why. I've had Vicodin. I had my gallbladder removed. I took one Vicodin and I absolutely hated it. Narcotics are not for me. I took one Vicodin, and regardless of how sore and bad I felt for that week, I just took ibuprofen. I couldn't handle the Vicodin, the narcotics. It was just horrible for me anyways. But some people, they take them and they get this euphoric effect, and they absolutely love them, and they're addictive, and they are very easy. They're easier to get than most illicit drugs. Obviously, you can just go to your doctor and be like, hey, I'm in pain. And the doctor will be like, hey, I'll write you a script for narcs. What's happening is with these narcotics, especially like fentanyl, that's a big one. And fentanyl is, I think I'll talk about it here later, but it's a synthetic narcotic. And I'll tell you what that is here in a minute, what that means. But they're starting to put something called carfentanil in it. And that's even more potent. And people are taking these and hitting them, and they're going, and the emergency that you'll run is basically, you'll realize that people are narcotic overdose, and they're not breathing. It will suppress your respiratory drive. And if you take too much of it, you'll breathe like 2 times a minute, like once every 30 seconds. And I've ran people where they're having 1 breath a minute. We walked in and we're like, oh man, they look dead. They're all blue and mottled skin, and they look gray and ashen. They look horrible. And then you walk up to them and you feel for a pulse, and they'll scare you because they'll go, oh, you're like, oh my God, they're alive. Holy crap. And then you got to start bagging them. Excuse me, Rona. Start bagging them. And then you'll have to start dealing with that. They give you, these are the examples of them: oxycodone, Roxy, Oxy, heroin. Heroin is the natural morphine. Codeine is amazing. Codeine is actually a cough suppressant, and it was given out big time for like kids with a cough. Here, have some codeine. Savannah got some codeine. She had a really bad cough. Took her to the doctor, like, hi, I'm gonna give her some codeine. I was like, oh really? Yeah, like let's slow this cough down a little bit. So they gave her codeine. So it is a narcotic. There is natural and synthetic. And where that comes into play is there's something called opium. And it's a flower. It's a plant. I think I got a picture of it somewhere. Oh, I didn't put it in. Sorry, guys. But opium is a plant. It's naturally based. And you can derive a lot of these from there. But fentanyl is a synthetic. Somehow they figured out how to chemically make this drug without using opium. They figured out what the chemical nature of it, and they've been able to synthesize it. The thing with fentanyl is it's morphine relieves pain, but fentanyl is supposed to be about 1,000 times stronger. And believe it or not, the dosing is much, much smaller. Milligrams is what you give morphine in. Micrograms, which I'll explain when we get to pharmacology, which is like 1,000 times smaller dose, and it still has similar effects. All right, so there are opioid receptor sites, or narcotic receptor sites. So what happens is that basically you take these and they bound to these receptor sites, and that's where you get all this euphoria that it comes from. For me, there was no euphoria. It was just I felt nauseated. I felt horrible. I was already not feeling good. It really didn't help with the pain for me. Maybe I needed to take another dose, but like as soon as I started coming off it, I started actually feeling better, and I was sore and still hurting. I said, screw that, I'm not doing it again. So for me, it was no fun. Again, though, but they say it's some sort of like a euphoric state, impressive dreamlike state. Again, I don't know. The bad thing with narcotics, they also slow down peristalsis. So basically, these people are having their fecal material in their gut longer. And where that comes into play is when it comes into the colon. Remember, the whole purpose for the colon is to absorb moisture and fluid and water back out to try to recycle it. But what's happening is it's slowed down peristalsis, so it gets a lot of the moisture pulled out. And then you have this hard, compact stool that is very tough to pass. So they become impacted. They also have constipation, so they're trying to use Miralax to combat that. So that's another thing. If you see somebody that's got a lot of Miralax and a lot of narcotics, then yeah, it constipates them. And it doesn't take long. I tell you, it does not take long for them to get constipated. Like I said, one of the things that you can really, really, truly tell a narcotic overdose, and it's out there, guys, it's very, very prevalent. Pinpoint pupils, respiratory depression, hypotension. And they did not put, but basically bradypnea, if not apnea, or near apnea. So it's out there. That's how you can tell. And that, like I said, you'll walk in, that presentation will give that toxidrome, the opiate toxidrome. That's what you're looking for. Narcan's a big reverse for that. So if you if you have a paramedic like me, I've actually gave too much morphine before. So I just give it a little bit of Narcan to kind of take the effects of that off. The problem is, though, if these people are taking narcotics and they are truly in pain and they just happen to accidentally overdose, again, intentional accidental overdose, it can happen. They take too much of the pain medicine. They're not trying to hurt themselves. They're not trying to get high. They're just kind of hurting, so they took a little extra dose. Hurting more than usual, take a little extra dose, and then they wind up being in respiratory depression and stuff like that, hypotension. And then you give them Narcan. The bad thing about Narcan is that it will block all of it. So if they took pain medication and you give them Narcan, they're going to be in pain and hurting. Like, they're going to be hurting as bad, like significantly worse, because they're used to having the narcotics on board. You give the Narcan, it'll reverse that. Also, though, but the cool thing is, like, what they're starting to do is they're starting to let officers, you're welcome, Kazmar, another plug for you. Kazmar, you're like the star of this show. Police officers that run this, and it's pretty much obvious it's a narcotic overdose or heroin overdose, they'll go ahead and you can nasally atomize this. What this little thing at the end does, you can stick it up a nostril, and you can do 1 milliliter per nostril, and I think this is 2 milliliters, if I'm not mistaken. And you can spray 1 milliliter in each nostril, and then it'll absorb through the nasal mucosa, because it too is very vascular, and it'll reverse the effects. The problem is, like I said before, is when you start having these heroin overdoses, fentanyl overdoses, mainly heroin, for heroin, they're starting to put in that carfentanil, and it is 1,000 times more potent. It used to be you can give some Narcan, like one 2 milligram pre-filled syringe of Narcan, IV or intranasally, or you can do IM too. You can just do it as a shot in the deltoid because you can't get vascular access. I've done that before too, and people come back around. Now, the last one I ran was probably about 6 months ago, and it took 8 boxes. That's 16 milligrams of Narcan. I know that doesn't mean anything to you, but I'm telling you, it used to be 1 box. Now I'm using like 8 boxes to try to reverse this, to get her to wake up and just kind of talk to me. She was bad. She was way bad off. So it's there. They also talk about sedatives and hypnotics. Sedatives are basically central nervous depressants again, kind of slow down the brain activity. Hypnotics kind of put you in a state that feels like you're inducing sleep is what it's supposed to do, but it kind of disassociates you. It makes you not really there. Like, you're there, but it like kind of just takes you away. Sedatives are used to reduce anxieties, and hypnotics are medically used to produce drowsiness and help with sleep. Sedatives, barbiturates and benzos. These are also drugs. More so benzos now than barbiturates because of the side effects of the barbiturates. We'll talk about that when we get to farm. But just know that benzos is like your Valium, your Versed. It's basically anti-seizure medications. If somebody's having active like tonic-clonic seizures, that's the medicine we're looking to give. Might be a test question. Treatment, ABCs, all again. If they're hypotensive, you may have to do some boluses of fluid to get them back up through your IV. Again, stuff we'll talk about in advance when we get to the pharmacology section of what you can do and what you need to do for this specific toxidrome. Alcohol. I really don't know what else to say, but it is probably the most quote-unquote abused drug in the U.S. That is not a lie. Alcohol is legal. Everything else we've been pretty much talking about, except for the narcotics in are legal. I know narcotics are legal, but typically people don't get them through legal means. I I know people that they get prescription for narcotics and they're like me, I don't take them, and they wind up giving them to family members who turn around and sell them, whatever. Same with benzos, but alcohol is the most prevalent legalized drug that we have next to nicotine. It is also a central nervous system depressant, which means it'll slur speech. In small moderation, it winds up taking our it takes away all our inhibitions. Basically, all the things that we would normally do, like that we would think like, that's probably a bad idea, shouldn't do that. It's kind of like, oh yeah, no way, I'll do it now. So it kind of takes away all our reserves too. Like, if you're afraid to talk to a girl, we'll take a couple shots. About 10, 15 minutes later, you're feeling kind of a little bit braver, and so you'll go over and talk to the girl. So something like that. Slows the reflexes, slow down reaction times, car wrecks. That is why we have DUIs, because it does this, and you should not be driving, obviously. Not really saying anything that you guys don't already kind of know, just kind of recapping. That you can have alcohol poisoning. There are people that will just drink and drink and drink and drink. And especially if, again, I go back to the word tolerance. You build up a certain amount of tolerance to alcohol, just like any drug. You'll build up a tolerance. Even prescription drugs, you can build up a tolerance. So with that being said, you build it up, and then but like, there are people that just never have drank before and just drink and drink and drink and drink and drink, and they die of alcohol poisoning because there's just too much alcohol in their bloodstream. Physical dependence and withdrawals is something called DTs, delirium tremens. Like, people will be shaking and have a hard time focusing when they try to come off alcohol. Believe it or not, they do kind of have to step down. I will talk about, when we get down to it, radiator fluid, and why alcoholics, when their family takes it away, they'll drink radiator fluid, and I'll tell you why here in a little bit. Hepatitis, it destroys the liver. Alcohol over a period of time will destroy the liver. Inflammation, cirrhosis is when it starts actually not functioning and not being able to do its job. Consider bleeding, because remember, we also talked about esophageal varices. We talked about hemorrhoids with cirrhosis and stuff like that. So maintain the ABCs, oxygen, talk to them, manage your hypotension with IV fluids, stuff like that. I threw this in here for your toxidromes. It kind of tells you with heart rate, blood pressure, respiratory rate, their body temperature, pupils, bowel sounds, and if they're sweating or not. So obviously, I threw that in there for you to look at. I'll let you look at it on your own. They do talk about substance abuse. Obviously, these things we're dealing with here is not just an accidental overdose, but also the fact that there are people that are very chemically dependent on these drugs. So it can be abused. It can become too much, and then they get themselves in trouble, and then there you are, EMS, trying to save this person that you know. That's the bad part. You know you're going to save this person or help this person, and they're just going to turn around and do it again. It's very frustrating. So, but that's not for you to worry about. That's not your concern. Your job is to just do your job in the moment and take care of the patient right then and there. I talked about tolerance, habituation. Habituation is basically the habit of doing it. People do it because there is a physical and a psychological dependence. They used to say that drinking alcohol or doing any of these substances was just, it's a state of mind. Change your mind and you can be fine. Well, it turns out through psychology, they found out that there is a physical dependence on this. People actually do need to have this drug. I will worry about potentiation and synergism when we get to pharmacology again. When we start talking about your drugs in advanced portion, we'll start doing that. But there are withdrawal symptoms, and basically the physical and the psychological portion of that go with the withdrawals and stuff like that. So, all right, so we're going to blow through this really quickly. Your scene safety. You need to pay attention to the scenes surrounding. Just like psych emergencies, if you have people that are altered and they could be potentially dangerous. More likely when you're called, most of the time it's gone too far. And you have to do something to maintain the patient, do something. If they're revved up on methamphetamines, like I said, I've had to chemically sedate people. Also, if you got alcoholics or you got heroin addicts or anyone who takes narcotics, you're gonna have to deal with that. On the reverse spectrum, they're altered. They're not revved up. They're revved down, and you're gonna have to go ahead and manage that patient. Wear your PPE. Again, another thing you want to be cognizant of is that the fact the patient may try to hurt themselves. So, be wary of that, because you may not see the gun that they had planned on, like they're going to get drunk and kill themselves. Well, they got drunk to the point where they passed out, and now you're dealing with this altered mental status patient, or they took a bunch of narcotics and stuff like that. So just be aware. Scene safety is very paramount. Clues. Hello, rolling meth lab. Hello. So just be careful. Look for, smell their breath, look at their eyes, their heart rates, all those things. And that's why you got to learn these toxidromes, because they'll clue you in of like, man, I don't know what's wrong with this patient. I think they're high. Yeah, they probably are. So that's things you need to be paying attention for. Form your general impression. They might be conscious, they might be alert, but they may not. So don't be fooled in. Don't be lured in. They could be altered mentally. Even though they're alert and oriented, they still might not be mentally capable of functioning. So be careful. Pay attention to airway and breathing. That goes without saying. Circulatory status. We can fix that, kind of. Sample history. Again, that falls in. Hey, have you done any recreational drugs today? I'm not the cops. Just let me know. Pay attention to medical jewelry. You want to look, they'll usually wear it around their neck or around their wrist, and it'll be a medical ID bracelet. It might clue you in. They've got stents placed, and they might take that medication for blood pressure, and you might find 2 or 3 different medications, like, oh my God, and one or two of them are new. Like, oh goodness, they just had a heart attack, now they're taking this blood pressure medication, and they've taken too much. You can ask all these questions. Aspiration and vomiting is very important. Weight is important in case you do have to give an antidote. Usually they're kind of weight-based dosing. You can do that. Basically, that means you have to give a certain amount of milligrams per kilogram, not by pounds, but by kilogram. You'll have to take pounds, convert it into kilograms, and go from there. What possible agent could they be taking? Usually who's going to clue you in is family. And I hate to say this, but usually if you get somebody in their late 20s, early 30s, and they are living at home with family, the family knows that they're doing this, or they were trying to help them, and they're not clean anymore. So, and then obviously the route, and when's the last time you saw them normal? How long was that? So, is there anything else? Because sometimes people will take narcotics and drink, and they're both central nervous system depressants. So there you got them doing, narcotics and alcohol, and put together, it makes it even worse. Do your secondary assessment. Just keep reassessing. If they're 5 minutes, if they're unstable, 15 minutes if they're kind of stable. Reassess. Make sure your interventions are working. This is like your medical scenario. Just do your reassessment. You may have to contact medical control and get orders for any type of reversal agents, stuff like that. Scene safety is paramount. ABCs, treat shock. You may have to give activated charcoal. Probably have to contact medical control for that if you don't have standing orders. They do talk about marijuana, cannabis. It's also euphoric, causes drowsiness, poor motor control, bloodshot eyes. I've never met somebody that is overdosed on marijuana. I haven't. And usually they're just real chill, real cool. And they'll tell you, like, yeah, I smoked some marijuana today. Those are usually the coolest people to transport. And usually you probably get a panic attack, and somebody's like, yeah, I've been smoking some reefer today, just trying to chill out, but it's not working. So hallucinogenics, mushrooms or shrooms, LSD, PCP, I want to say Molly is also MSDS or MSD or something like that. I don't know. I don't do these drugs, so I don't know. Hallucinogenics, they basically see things that are not really there. So, again, don't play into it. Just do the best you can. Try to coax them into going to the hospital. That's your job. That's what you're supposed to do. Again, I go back to the cardiac meds. There's a chance that all the cardiac meds, that they can also be very detrimental. They're supposed to try to help have people with dysrhythmias and hypertension and too much calcium and stuff like that. So they can go see multiple doctors. Their general doctor gave them a blood pressure medicine. Then they saw their cardiologist. So yeah, like, I'm going to put you on this blood pressure medicine. Because some people walk in and they truly don't know their medicines, which is ridiculous. They don't bring them with them. They don't think that they need to have them. And just people don't know what they don't know, apparently. Especially if they've never really seen the doctor either. So there's that. Again, this is what I've been talking about this whole entire time. There's metoprolol and Lopressor. That is the exact same medication. I've seen people like with metoprolol, Lopressor, and they've been taking them both. One is new, one is old, and one's from their primary, one's from their cardiac doctor, and now they're taking both of them, and they're basically double dosing. And they're like, I feel weak, I feel horrible, I don't feel good, and like, okay. And so through my history, well, what kind of medicines do you take? Any of them new? Yeah, this is new. Oh, well, that's the problem. So there you go. You'll have nausea, vomiting, hypotension, difficulty breathing. They might have a headache. They might have an irregular heartbeat, something of that kind of nature. So you'll look for that as well. IV access, patent airway. It's just reiterating the same stuff over and over again. You guys go through your assessment. You'll be fine. ED medications, erectile dysfunctions. You can't give nitro with her. So if they're having chest pains, you need to ask them. This should be standard on every male patient under the age of 90. Did you take erectile dysfunction medication? Do you take like Viagra, Cialis? Because those medications potentiate together and they will greatly drop blood pressure. You'll take nitro, which will drop blood pressure, but these help drop blood pressure as well. That's how it works. Psych meds, MAOIs, they used to be what they would treat for like all like the psych therapy for depression and stuff like that, but they can create hypertensive crisis if they take with certain foods, the triamine containing foods. These are triamine containing foods: beer, cheese, wine, sourdough, sauerkraut, soy products. So that can happen. They're MAOIs, I'm not going to even gig you guys on those because they're not even really prevalent anymore. These are prevalent, though. SSRIs. These are psych medicines that are used now. So they can overdose on them. Usually, SSRIs are used more now because if you don't need them, it doesn't really help you. So you kind of take them that you don't need it. That's not the cause of the depression or whatever. So there you go. I'm not really going to get into them. Bipolar depression. Remember, I told you the cyclic or the cycle of 6 months. They go up, they get this manic high, and they're going to conquer the world, and then they have all these really cool dreams and ideas, and they don't do anything about them, and they just kind of spin their wheels in motion over and over and over again, and then they fall down into kind of a normalcy, and then they go into this great depression. Lithium is the treatment. They can overdose on the lithium. I'll be honest with you, though, people with bipolar depression, the reason why they still have bipolar depression is because they don't take lithium, because lithium basically makes them devoid of all emotion. And they say from I've heard from bipolar depression people, they would rather feel those episodes every 6 months than not feel anything at all. So they don't take their lithium. NSAIDs, they can be too much. Yeah, they need supportive care. Like I said, I've seen people, like especially teenagers, that want to hurt themselves, and so they decide to overdose on Motrin. It's not that. I don't want to say it's a big deal. It is a big deal. They try to hurt themselves, but it's not too bad. It can be devastating, but where the problem comes in is where people use it for long-term use. I know people that take 800 to 2,400 milligrams of Motrin a day, if not more. I am very sparing with Motrin. I like the fact that I don't want to have a tolerance to it. So when I do use it and I am sore or I'm hurting somehow, some way, it helps greatly. Aspirin, it can be bad. Where you're really worried about is kids and what happens with kids. I'm not really going to gig you on this either, but just know that it's out there that if you have a kid that's got a fever and parents don't really know, and they wind up giving them aspirin and they keep giving them aspirin and they're trying to bring their fever down, and that's kind of the indication. The kids will complain about ringing in the ears. That's usually, it's called tinnitus, and that's usually the sign of an overdose of aspirin. Acetaminophen, Tylenol. I've seen people try to kill themselves or hurt themselves by ODing on Tylenol. Let me tell you, That's a bad death to have. That doesn't kill you right away. Tylenol will mess up your liver in a heartbeat, and it'll do it in about 2 or 4 hours. They need, if they've taken it and you can get them to take the activated charcoal, by all means, please do. If you're in the window. If not, there is an antidote, a reversal for it. It's called acetylcysteine, also known as Mucomyst. But they need to give an IV, and it needs to be given IV in an ICU. So, and again, you've got about 8 hours before it really starts messing your liver up bad, and depending on how much you took. GHB, which is the date rape drug, there's not really much you can do for it. It is a central nervous system depressant. Usually the people that you're dealing with are the people that have been sexually assaulted after they come to. So I just want you to know that it's out there. If you haven't heard of the date rape drug, it's called gamma hydroxybutyrate, and it's GHB. Also known as, I think, roofie. Carbon monoxide poisoning. This one is a big deal. When you go into someone's house, if they've got like an old like wood burning stove, or they've got some sort of, I think it's butane, I forget. I'm trying to think if it's on there. Anyways, kind of gave it away. But basically, colorless, odorless, tasteless gas. So with that being said, if they've got these old style heaters, I've ran a patient that was altered, and nobody else in the house was altered, so we thought something else was going wrong. So she had an extensive medical history. We couldn't really figure it out. It was up here when I was in Towns County. We flew her out. What it wound up being is that she was bedridden, and so everybody would get exposed to this carbon monoxide overnight. Go out in the house, go to school, go to work. They would off-gas the CO. And come back in the house, and they pick it up again. Well, they were picking it up and blowing it up enough to make it so that they weren't becoming altered. But you can go into a house, and one of the key indicators that they say is if you walk into a house and you've got a bunch of people that are altered mental status, and you walk in and you start having a headache, start feeling dizzy, that's when you need to back out and probably mask up to get these people out. Get the fire department to use their SCBAs. Go in and get these people out for you. Headache, nausea, dizziness, breathlessness, the collapse, and dealing with loss of consciousness. We were dealing with the loss of consciousness. And it really wasn't truly loss of consciousness with that woman, but the bedridden woman was definitely altered. If you haven't figured this out, this is probably more than likely a suicide attempt. This is what you need to be very, 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 very careful of. Believe it or not, in old cars, if there's a leak somewhere, like I've seen somebody have carbon monoxide issues because their floorboard was rusted out where their muffler had rusted out. So the muffler was literally kind of still going out the back of the car and being pushed out that way, but also someone's coming into the vehicle itself. So there's that. Obviously, this is somebody trying to commit suicide. They hooked it up to the tailpipe, ran a garden hose, or whatever flexible tubing they can get to go into the window, tape it up, and then they turn it on and run the car. So obviously this is a sign of possible suicide, and you're probably going to have an altered patient. The problem with carbon monoxide is that it has an affinity. Let's see, did I put that in? I did not. It has an affinity and for the hemoglobin on our red blood cells. What that means is O2 has an affinity, and it'll attach to the hemoglobin. We covered that when we talked about our red blood cells in our hemo chapter. But carbon monoxide will bond to it tighter and hold longer. And it takes a lot to get it off. The only way that you can get it off in a severe poisoning is a compression chamber. I forget what they're called. Barometric chamber, where they've got to increase the pressure because you need that pressure to squeeze down on the body and gets to the red blood cells, and it knocks that CO off and they breathe it off. So that's how that works. It's basically CO has a higher affinity than oxygen or CO2. Carbon monoxide will bound to the hemoglobin, hint, hint, wink, wink, nudge, nudge, and has a higher affinity for the hemoglobin than our oxygen and CO2 does. It will bound, and what happens is it holds on that hemoglobin, so oxygen and CO2 can't get off. So you're having hypoxia, and then you're having the CO2 build up inside the body, making them acidic, making them altered mental status. That's why that works. Talk about metals. Iron, the only real people I've ever seen that have iron toxicity is basically they take an iron supplement and they're taking too much. That can happen, especially in your hemophiliacs that need to take iron, that have a hard time clotting. They'll take iron because they need it to help clot. Lead, I haven't seen lead ever. Lead used to be in our paints, and you would find them in other household products. I think they've been pretty much removed from our household products. I'm not sure. There's still some lead-based paints out there, so be careful. Chlorine gas, it'll basically burning sensation, ear, eyes, nose, and throat, and that's usually people cleaning their pool, if they're cleaning their pool. Cyanide, fire, usually have cyanide poisoning. Usually be somebody that's been caught in a fire. That's where you're gonna have cyanide poisoning, along with a lot of other toxic gases and chemicals. Caustics, burn. Usually people will swallow it, and it'll mouth pain, throat pain. They'll have pain in their chest. It'll burn the esophagus and stuff like that. All right. So we talked about antifreeze. So alcoholics will do antifreeze because the reversal agent is alcohol. I'm not kidding. And people or alcoholics that know this, like say if their family is trying to punish them or whatever, took away all their alcohol and they get a hold of this antifreeze and they'll ingest the antifreeze. Now, first of all, let me tell you, antifreeze, I've had some splash in my mouth, unfortunately. But it wasn't enough to be harmful. But I'm telling you, antifreeze tastes delicious. It's very sugary. I don't know why, or at least it tastes sweet. I don't know if it's got sugar in it or not, but it's very sweet. So if you spill it, and dogs and cats and animals will lick it up, lap it up, drink it, whatever, and they wind up dying because it will mess up your kidneys in a heartbeat. It will mess them up so they will not function again. It will kill your kidneys. So that's why alcoholics will drink this, because high concentration alcohol is the remedy for that. I've had somebody do this with me, and they're an alcoholic, and their significant other was punishing them, telling them they're an alcoholic, they're drunk, didn't understand how it works, that they're going to have DTs. They're physically and psychologically dependent on this alcohol, and so they knew that if they drank antifreeze, they would get alcohol, and that's what we did. We basically broke out the gin. They had gin in their house, and we said, all right, chug this gin. And they got to get drunk, and it helped neutralize that. They still wound up being flown to the hospital, obviously, because there's still the repercussions of destroying the kidneys. But that's just something you will find and you may deal with. I just want you to be aware. Hydrocarbons, basically your gasoline, motor oil, waterproofing agents. They usually will huff them, or I call huffing. They'll inhale them. It can kill you immediately with respiratory distress or respiratory arrest, which means they stop breathing. It's in cosmetics, oils, lotions, stuff like that, apparently. Something I wouldn't know. I don't use any of those products, but they're there. Food poisoning is usually going to be some sort of virus, bacteria, something of that nature. Just treat them as best you can. What you need to worry about with food poisoning is if everybody has it. Figure out what everybody ate or where they ate it from, and then try to trace it back that way. Manage them, supportive care. Do the best you can with what you got. Poisonous plants. Usually this is where children will go out and they'll eat the little berries or the red berries off of plants and stuff that are poisonous. So that's where you really want to be very careful of. Poison control is going to be your best friend. Take a picture of the plant, because I think you can send it to them if you know what it is. But you may not know, man. Kid will go outside, play for a little bit, they ate something, they come back in, and all of a sudden there they are seizing, foaming at the mouth, and then you're just trying to figure out how to just manage the patient. So that does happen. There's some of your poisonous plants. No clue. No idea. I don't know what to tell you. I think there's a list of who the photographer is, but it doesn't tell you what it is, so I apologize. More poisonous plants. And there you go. Welcome to reality. These toxidromes are real, people. You need to study their signs and symptoms and learn the toxidromes. Last time I checked, there was 13 toxidromes. We're not holding you accountable for all of those. Cholinergics, anticholinergics, sympathomimetics, which stimulants fall under sympathomimetics, narcotics, and that's pretty much all we're holding you to. So it could be worse, but anyways, I'm signing off, guys. Long lecture. Thank you for listening. Love y'all. See you later.